Okay, this is a quick snippet of the lower back pain and sciatica workshop. We talk a lot about the three types of lower back pain. That's lesson number one. We know that sciatica is not enough. That just means that there's sciatic pain. It does not tell you what type of lower back pain that you have. So 90% of all low back pain out there comes into these three types, which is herniated disc, SI pain, which stands for sacroiliac pain, or stenosis. Let's talk about herniated discs first. So the level that herniates, here's the picture. You can see the little red disc that's pushing out here. Discs are material that are pliable, kind of like crab meat. And you can see when the disc pushes out, it pushes on the sciatic nerve. We know that the most common area is the L4, L5, which is the second to last vertebrae in the spine. 75% of the time it's that. We also know that it's really important to identify that there's main markers that help us know if the disc herniation is causing the symptoms. Are you 35 years or younger? It's the most common. The symptoms increase when you bend forward, when you cough, when you laugh, or when you sneeze. Okay, that's very important. There's pain, numbness, and tingling or weakness down the back of the leg. And we know that 85% of the time, within 6 months of conservative treatment, people are able to heal a disc herniation. We also know that research indicates only 50% of the time surgery is successful. Moving on to the second type, sacroiliac pain. So the sacroiliac is right here. The ilium, the pelvis meets the sacrum. That is a joint that has some movement. When that movement becomes excessive, the joints start to rub, and the rubbing causes inflammation. Signs and symptoms are it hurts when I sit, hurts when I lay down, hurts when I bend over. It's usually on one side, and you can point to the spot. Pain that can radiate into the groin or wraps around the lateral thigh. It's common in all ages, very common during and after pregnancy, and it usually only hurts on one side. And it usually doesn't travel down the leg. And can it be healed? Absolutely. We just have to reduce the friction that's happening in the joint. Now, the most common topic is stenosis. Stenosis is the Latin word for narrowing. That means that the hole where the nerve comes out in your spine is becoming smaller. That happens as we age. I can tell when somebody has stenosis based on research. A research tool that was designed that's 97% valid. If you have these four things, if you're over the age of 50, if you have pain in your lower back or down your leg with walking and standing, and the relief happens when you sit down, 97% of the time we know that that is because of stenosis. That's the type of pain or the type of low back pain that you have. Here's an image of that. You can see the nerve comes out of a hole. That hole has a diameter. As the diameter gets smaller, the nerve gets compressed. It's also called disc degeneration. Now it's important. This is my most important topic of the workshop. Stenosis means narrowing of the hole the nerve comes out of, but I want to explain that the hole is actually 1/2 circle here from this moving vertebrae, and then 1/2 circle here. That means that the hole is dynamic. It is not a fixed hole. It moves when you move. There's three ways to make the hole narrow, and narrow equals nerve compression. I can extend backwards, or backwards bending. I can bend to the same side. So if my left low back hurts, I can bend to the left, and that makes the nerve hole smaller. And if I can rotate away. So if my left side is the one we're focusing on, I can make the hole smaller by rotating to the right. So it's important to understand that stenosis does not mean that you can't do anything about it. There are three ways to make it worse, which we just talked about, and there are three ways to make the hole bigger, which is bending forward, bending away, and rotating to the same side. So those are my quick and easy ways to describe the top three types of lower back pain. Hope you enjoyed.